Madam Speaker, I want to thank my colleagues for the opportunity to speak to the conclusion of this statement. Madam Speaker, I have been authorized by the Cabinet to make the following statement. It was on 31st December 2019 that the World Health Organization, commonly called the WHO, learned of a cluster of cases of viral pneumonia of unknown cause in Wuhan, China. This unknown virus spread exponentially throughout Wuhan. Scientists began to take note and were making inquiries of the WHO about the novel virus that appeared to be spreading rapidly amongst the human population in Wuhan and other areas of China. At the time, Madam Speaker, little was known about this infectious pathogen, but what became quickly discerned was that it was causing a respiratory illness and was spreading from person to person via respiratory droplet infection. It was determined that the virus had an incubation period of about 14 days. Madam Speaker, this virus was later identified as belonging to the coronavirus family. It was subsequently officially named, and I quote, Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. And the disease which it caused was named COVID-19. In January 2020, the government began via the Ministry of Health to sensitize the population about growing concerns surrounding this virus that was spreading at a frightening rate in China. On January 30th, 2020, the WHO declared the COVID-19 outbreak a public health emergency of international concern. This is WHO's highest level of alarm. Internationally, Madam Speaker, eyes were fixed on the events rapidly unfolding in China, and nations began to prepare for the possibility of global spread. The government of Trinidad and Tobago was the third in the world to begin by taking precautions and implementing entry restrictions on persons traveling from China within the previous 14 days. This was done on January 30th, 2020. And the decision didn't sit well with some people who thought that we were overreacting. On March 11, 2020, the WHO declared COVID-19 a pandemic. At the time, the virus had been detected in 114 countries, and over 4,000 persons had already lost their lives, and there had been more than 118,000 confirmed cases reported globally. It was the first pandemic ever caused by a coronavirus. This virus has claimed almost 5 million lives worldwide and continues to claim lives. Madam Speaker, we also took an early decision to build out what has become known as our parallel healthcare system to handle COVID-19 cases separately from the rest of the public healthcare system. In order to operate such a system, the following facilities were and are mostly still dedicated to serving COVID-infected persons. And I refer here, Madam Speaker, to Cora Hospital, Couva Hospital, Arima General Hospital, Augustus Long Hospital, St. Anne's Hospital, Scarborough Regional Hospital, Scarborough General Hospital, Point Fortin Hospital, St. James Medical Complex, the Field Hospital at Couva, the Port of Spain Field Hospital, and the Point Fortin Area Hospital. COVID-19 step-down facilities were also established at UTT Valsain, the Debe step-down facility, Tacarigua Rocket Center, Ray of Hope, and Lowlands, Tobago. Madam Speaker, this far-reaching decision has saved many lives. Unfortunately, to date, we have maintained our public healthcare system without it collapsing under the enormous strain of COVID-19 during the various surges we experienced. It was one day after WHO declared COVID-19 a pandemic on the 12th of March 2020 that we recorded our first case. It was an imported case. Madam Speaker, we have been responding to COVID-19 virus in Trinidad and Tobago for over 2 years. The government, and indeed the population, has had to make numerous adjustments over time at various intervals as we literally battle the pandemic and the effects of the virus. Our people have shown resilience as we navigated the unknown. At all times, Madam Speaker, the government's response to and management of the effects of COVID-19 has been guided by the available scientific information and analysis, as well as the desire to preserve lives. We have relied on the advice of our team of expert public health care professionals under the leadership of our Chief Medical Officer, Dr. Roshan Parasram, the guidance and learnings from WHO and PAHO, and our observations and analyses of the effects of the virus on other countries and the various responses thereto. Madam Speaker, as Prime Minister, over the past 2 years, on numerous occasions, I have addressed the population on our management and various responses to COVID-19. I have done so in the Parliament, via addresses to the nation, and via regular press conferences. It was not too long ago, Madam Speaker, in December 2021, that we were actually in the midst of the largest surge of positive cases that Trinidad and Tobago has seen to date since the onset of the pandemic. This significant surge in COVID-19 confirmed positive cases was brought on by the emergence of the Delta variant of concern, which has demonstrated to be a formidable variant of the COVID-19. Delta proved to be more virulent, causing more severe disease manifestations. It translated into large increases in hospitalizations and deaths among our population. It was also characterized as being more transmissible than all of its predecessors. It is estimated, Madam Speaker, that one person infected with Delta is able to transmit the virus to approximately 5 to 8 other persons. Trinidad and Tobago began to detect Delta variant at the community level in early September 2021, and the trend of increasing hospital occupancy was confirmed from October 17, 2021. In Trinidad and Tobago, at the height of the surge, the highest level of activity were experienced during the month of December. The 7-day rolling average of new cases peaked at 795 on December 9, 2021, while the 7-day rolling average of new deaths peaked at 27 on December 24, 2021. These deaths, Madam Speaker, remain largely among persons over 60 years of age with multiple comorbidities, for example, diabetes, high blood pressure, hypertension, particularly those who were unvaccinated. The parallel healthcare system and accident and emergency departments also recorded their highest occupancies during the month of December 2021. The highest number of patients at the accident and emergency department was recorded on December 15, 2021 at 8 a.m., with 212 patients being present within the 10 accident and emergency departments. The highest national occupancy levels, 84%, was noted on the 23rd of December 2021. the total number of patients in the parallel healthcare system was 755, representing 84% of overall occupancy, with 5 times as many patients requiring high acuity care. On the 23rd of December 2021, there were 168 patients being managed in the accident and emergency departments. In total, the public health sector was managing 923 patients with confirmed COVID-19. Our public health care system was indeed stretched, Madam Speaker. Madam Speaker, I pause here once again to place on record our gratitude to all of the healthcare workers who worked tirelessly from March 2020 to date, and in particular during the surges, to treat patients with COVID-19 who required various levels of hospitalization. Madam Speaker, I'm sure all of us in this chamber would like to say thank you. I thank all frontline workers. I thank also all frontline workers, and not only our healthcare workers, but all those who have kept Trinidad and Tobago going during this pandemic, ensuring that our essential services functioned, from electricity and water to security and food production. Madam Speaker, peak intensive care unit capacity, 97%, was recorded on December 18, 2021, with 78 of the 80 beds being occupied in the parallel healthcare system. At the Accident and Emergency Department, Madam Speaker, 26 of the 29 ICU beds, that's 90%, were also occupied, leaving us with 5 beds available on that particular day. Added to the presence and danger of the Delta variant of concern on November 26, 2021, the world, through the diligent work of South African scientists, became aware of a new variant, which soon thereafter became the 5th variant of concern, known as Omicron. In the very early days following its detection, little would have been scientifically determined regarding its disease traits. However, it was soon discovered that it was certainly more transmissible than Delta, which was also the dominant strain in Trinidad and Tobago at that time. Research efforts also subsequently determined the Omicron variant of concern as having an increased secondary attack rate, and information regarding its virulence in the early stages was not immediately known. Given that what we were experiencing with Delta in mid-December, and given the observed characteristics of Omicron, there was great fear and trepidation as to what might be in store for us as Omicron inevitably take hold. In anticipation of the arrival of Omicron to our shores, on top of the presence of Delta, we knew that this new variant posed a significant threat, and we anticipated that the number of hospitalizations and commensurately the number of deaths would be likely to increase exponentially. Madam Speaker, as we had done throughout the pandemic, we stayed in constant contact and interrogation with our public healthcare professionals. We were being updated on the situation facing us, including, but not limited to, the hospitalization rates, vaccination efforts, and suggestions as to possible management responses. As the days and weeks went by, new data surfaced, first from South Africa and then from the United Kingdom and other European countries, where Omicron was quickly becoming the dominant strain, outcompeting other variants, including where Delta was both in high and low circulation. This therefore led to a consistent and significant rise in the number of confirmed COVID-19 cases in these territories. What quickly became evident, Madam Speaker, was that the severity of disease and thus the requirement for hospitalization in the adult population, as initially feared, thankfully did not materialize with the highly infectious Omicron variant. However, with Omicron, there was an increase in the number of pediatric infections, which subsequently led to an increase in hospitalization among children. This may have been attributed to the inherent vulnerability of this age group to infection, coupled with the fact that vaccination within this group was comparatively low. Madam Speaker, this was so because WHO only granted emergency use listing, the EUL, for the Pfizer vaccine for the 12 to 15 age group on June 15, 2021, and for the 5 to 11-year-old age group on January 21st, 2022. Madam Speaker, in order to prepare for the worst outcomes, Trinidad and Tobago further expanded its ICU and HTU capacities, together with making preparations for a concomitant rise in the number of pediatric hospitalizations. By January 2022, the Omicron variant of concern had become the dominant strain in Trinidad and Tobago. At a global level, the month of January 2022 also saw the highest number of new weekly confirmed COVID-19 positive cases since the onset of the pandemic. Of note, Madam Speaker, Trinidad and Tobago had not observed a sustained increase beyond Delta in terms of the number of cases, and thankfully to date, we have seen a significant decrease in the number of hospitalizations and deaths arising out of the new variant of concern. In fact, from December 23, 2021 onwards, a consistent but gradual decrease in hospital occupancy was noted. This encouraging trend caused us to hesitate and hold on any further drastic response, even as we remained wary of the presence of the virus amongst the entire population. In February 2022, the lowest occupancy levels in this current wave of COVID-19 were recorded. Over the past 2 weeks, Madam Speaker, overall hospital occupancy has steadily decreased from the benchmark of 40% to 31% as of March 1st, 2022. Madam Speaker, from February 1st to 28th, 2022, a similar trend has been noted across all levels of care and all facilities, including the Accident and Emergency Department dedicated to the care of confirmed COVID-19 parents. As of Tuesday, 2nd of March 2022, the following occupancy levels were recorded. Overall national occupancy, 31%. Intensive care unit occupancy, 31%. High dependency unit occupancy, 32%. Ward level occupancy, 31%. As of March 1st, 2022, all facilities in the parallel healthcare system recorded occupancy levels well below the 75%, which was the benchmark for alarm. As at 8 a.m. on March 1st, 2022, with the Accident and Emergency Departments of our parallel health, within the Accident and Emergency Department of our parallel healthcare system, a total of only 15 patients were being managed, with 0 ICU level patients. A consistent trend of decreasing admissions to the Accident and Emergency Department has been noted. Madam Speaker, thankfully, our worst fears have not been realized. Beside the inherent traits of the Omicron variant, our public healthcare professional team believes that the following factors may have contributed, also in some form or the other, to the welcome trends we have been observing in Trinidad and Tobago at this time. I speak here about population vaccination. Trinidad and Tobago began its main vaccination drive in April 2021. By late 2021, we were seeing a slow uptake of vaccines, and to date, we continue to see a very slow uptake in the number of vaccinations received on a daily basis across both islands. Despite our best and consistent efforts to ensure the availability of and accessibility to safe and effective WHO-approved vaccines, including employing various communication strategies, our progress in the continuation of vaccinating the unvaccinated in our population has been slow. This week, we were forced to destroy over 250,000 doses of Pfizer vaccines which had expired. Compare this, Madam Speaker, to the days in early 2021, when the unavailable but highly desirable gold standard Pfizer, that vaccine was regarded as the savior to take us out of the killing clutches of the deadly virus that was threatening to overwhelm us. This is after the vaccination level had virtually stalled at 50%, and as of this week, 3,642 persons, citizens of Trinidad and Tobago, have lost their lives to COVID-19. On average, Madam Speaker, the daily vaccination rate increases by 0.1%, which is well below what we hoped for in the face of this continuing threat. However, we continue to make vaccines available, and we continue to encourage people to get vaccinated, and especially to get the booster to strengthen and prolong effective levels of immunity. On a positive note, Madam Speaker, we are currently in the process of acquiring a new batch of pediatric Pfizer vaccines for the 5 to 11 age group, so as to ensure that our children are well protected once their parents agree to make use of those WHO-approved vaccines. To this end, exploration is taking place via the CARICOM Secretariat and CAFA, as well as through bilateral discussions. Madam Speaker, I signed the CARICOM agreement on Trinidad and Tobago's behalf a few weeks ago, and we look forward to receipt of vaccines for our 5 to 11-year-old population sometime in the not-too-distant future. Secondly, Madam Speaker, we speak here about population immunity. Population immunity is generated via two principal pathways. One, through vaccine-induced immunity, and two, through naturally acquired immunity following infection with or without symptoms. Trinidad and Tobago achieved the feat of fully vaccinating 50% of our population, 700,000 persons, on February 19th, 2022. That means 50% of our estimated 1.4 million inhabitants have either received 2 doses of a 2-dose vaccine or 1 dose of a 1-dose vaccine. We have also seen the continued rise of infections over the last 4 months, as previously identified. As at March 1st, 2022, we stand at a total of 128,145 confirmed cases. It can be expected, Madam Speaker, based on our testing strategies, whereby symptomatic persons are tested predominantly, aside from testing those for traveling-related purposes and other special groups, that we can anticipate that a larger proportion of the population would have been infected than confirmed. If one were to assume, for example, that for every 1 confirmed infected person, 3 other persons would also be infected but unconfirmed, we can extrapolate that approximately 30% of the population has been infected with COVID-19. These factors taken together, Madam Speaker, in addition to the reduced severity and increased transmissibility profiles of Omicron compared to the Delta variant, may explain the continued high infection rates seen daily without the consequent rise in hospitalization and deaths that has previously been anticipated. Madam Speaker, that being said, the pandemic is not yet over. Our greatest threat remains the emergence of new variants of concern, which can arise rapidly and without warning, as has happened in many countries during the pandemic. We must remain cautiously optimistic, whilst at the same time being highly vigilant and nimble in our response. To this end, we are currently well into the stage of living with this virus. That is, we are preparing to move from the acute stage of the pandemic into the endemic phase of COVID-19. In addition to vaccines, we now have some new therapeutics to help us fight this disease, and we are expecting additional therapeutics in the near future aimed at treating mild and moderate disease. Preparing for this endemic phase, we'll be making some adjustments to the parallel healthcare system. Madam Speaker, our parallel healthcare system has proven its resilience through the many waves of the virus, and the people of Trinidad and Tobago can take comfort in the fact that it can be readily escalated or de-escalated based on specific needs. I can confirm that yesterday, the Cabinet approved the Ministry of Health's recommendation for the consolidation and de-escalation of the parallel healthcare system in preparation for the transition from the acute phase to the endemic phase of COVID-19 in Trinidad and Tobago. As we guardedly begin this process of transitioning to the endemic phase of COVID-19, we would not like to ascribe any hard timelines yet, as we have learned that circumstances can rapidly change, which may necessitate consequent adjustments. In keeping with the general principles and the advice of our public healthcare professionals, we aim to transition from population-level controls to individual-level responsibility. However, as a responsible government, at this time, we cannot afford to abandon all our public health measures, which have served us well throughout the course of the pandemic. Madam Speaker, we are confident in the knowledge that after more than 2 years, the population has, for the most part, the wherewithal to navigate the vagaries of this pandemic. For some time now, we have considered and given increasing weight to the economic and social implications of how we respond to COVID-19. We have taken more risks as the population became more vaccinated. We reopened most of our economy. We have been cautiously getting more and more of our children back into schools. Madam Speaker, we have been concerned, very concerned, about our children and their being out of the physical school environment for such a long and abnormal time. I had hoped to be able to have all our children back in their schools at the beginning of 2022. But unfortunately, the surge of cases and increased hospitalization in December prevented this from happening. Nevertheless, we took steps and had our older children return to school last term, and we had recently seen our first and Forms 1 to 3 return and Standard 5 in the primary school system. This has been one of the more difficult restrictions for me to endorse, as I desperately wanted for all our children to return to their physical school environments at the earliest opportunity. In short, Madam Speaker, at this point, Trinidad and Tobago has weathered another surge of the COVID-19 storm, and we are in a reasonably good position. The government has done all that it could reasonably have done and to have been expected to do to provide our citizens with adequate health care for those amongst us who contracted COVID-19 and required hospitalization. We secured adequate WHO-approved vaccines to vaccinate our entire population above the age of 12 years old. And for months, we have staffed and resourced mass vaccination sites to vaccinate and even provide timely booster shots for our population. We have tried every reasonable initiative to encourage those who are eligible to get vaccinated. Get vaccinated. We continue and will continue so to do. When it's all said and done, Madam Speaker, as a government, we are not masters, but merely representatives of the people, and with a hard-to-reach 50% level vaccination, waning virility of the dominant Omicron variant, and large volumes of vaccines being dumped, the population is speaking very loudly how individuals wish to confront what's left of the pandemic experience. Madam Speaker, during the course of the last 2 years, notwithstanding numerous unsuccessful legal challenges, we have used the Public Health Ordinance to implement regulations designed to protect and preserve lives. We have had to institute a state of emergency to respond to COVID-19 at a time when the virus began surging, and we commenced and implemented our vaccination program, all aimed at maintaining this, at managing the spread of the virus and its negative effects on the population. Madam Speaker, I am satisfied that the government of Trinidad and Tobago, which I have the honor and privilege to lead, has done all that it could reasonably have been expected to do to preserve lives and balance the restoration and preservation of our economy. We are now at another milestone moment as we decide how we respond to the virus and manage our living with the virus. It is time for us to allow for greater discretion and personal responsibility in the society. I expect that our national watchwords of discipline, tolerance, and production would guide our social behavior as we go forward with living with COVID-19, and that the majority of our population will proceed with dignified restraint and be mindful that as we begin the process of lifting the remaining restrictions, we will be considerate of our brothers and sisters and the fact that the virus, which unfortunately continues to claim lives, is still amongst us. We have agreed now to add responsibility to our list of watchwords. Common sense and COVID-19 demand it. Madam Speaker, as we enter this phase of living with the virus and moving towards it becoming endemic, as it has already been declared in some other countries which were ravaged by their population, we have taken the following decisions going forward. The retention of masking. Appropriate mask wearing is an essential public health measure which should be retained at this time, especially due to the circulation of the extremely infectious Omicron variant, which lends itself to aerosolization and to significantly asymptomatic and mildly symptomatic disease. In late December 2021, the WHO re-emphasized its recommendation to maintain mask use in the face of Omicron. As such, mask use will remain in force at this time in all public spaces and places where there is public interaction. Public transport will be allowed to return to 100% of capacity. Mask wearing will continue to be required in vehicles being used for public transport, including all vehicles in which persons are paying to be transported. Families will no longer be required to be masked in their vehicles. This change will also apply to marine vessels being used by families. We are removing restrictions with respect to the length of time and numerical capacity at religious places of worship. Mask wearing will continue to be required during services at religious places of worship. The number of persons permitted at graveside funeral services will be unrestricted, but mask wearing is mandatory for the time being. For unvaccinated nationals returning to Trinidad and Tobago, a reduction in the quarantine time would be applicable. Quarantine time will be reduced from 14 days to 7 days, with discharge taking place on the receipt of a negative PCR test on the 7th day. Madam Speaker, we will decrease the national quarantine time for contacts of positive cases from 14 days to 10 days. This would allow for increased productivity and a decrease in the likelihood of staffing shortages, especially amongst the essential services. Of note, the Ministry of Health recently reduced the isolation time for positive patients from 21 days in all categories to 10 days for persons with no symptoms and 13 days for those with moderate to severe disease. They will be discharged in accordance with the discretion of the county medical officers of health. Public gatherings of persons in groups of no more than 25 is now to be permissible. The recommencement of team sports and contact sports is allowed. We will allow the establishment that are currently allowed to operate as safe zones for vaccinated or exempted persons and children under the age of 12 to operate at 75% capacity. Provided that we do not have dangerous changes in the COVID-19 position, we will permit all children to return to physical schooling in term 3. The Ministry of Education will continue to put out the necessary guidelines to safely manage this process. As of Monday, 7th March 2022, the public service will return to full service and all public servants will be expected to return to work as normal. Additionally, Madam Speaker, the Ministry of Health will be presenting a national pathway for the consolidation of the public health service that will see the return to the health system and by extension health services to an as near normal existence as the country transitions from the acute phase to the endemic phase of COVID-19. A structured, risk-based approach will be adopted to gradually reduce the footprint of the parallel healthcare system and regularizing the hospital system. The proposal will be implemented on a phased basis based on real-time risk assessment starting with point 14. The Minister will give further details next week. Madam Speaker, these initiatives will move us closer to the resumption of normal life and will be implemented via the public health regulations where appropriate, starting with those instructions coming from Monday of the week ahead. We continue to navigate the pandemic, and I trust that we will act responsibly and hopefully head towards COVID-19 becoming endemic in a population that has developed good immunity levels of protection, naturally or vaccine-induced. Madam Speaker, the now known and experienced characteristics of the Omicron virus allow us to make these decisions, but make no mistake about it. Even as we react to an almost endemic condition, it is possible that a dangerous new variant could appear, resulting in a swift review of these decisions because we are still in a pandemic. We look forward to being able to confidently join others who have already declared the virus endemic, but we must remain cautious as we move towards such time. Let us continue to be responsible. And Madam Speaker, may God continue to bless Trinidad and Tobago.
Member for Oropouche East.
Thank you very much, Madam Speaker. Pursuant to Standing Order 24.4. Honourable Prime Minister, in light of the statement made, could you indicate at this time whether the government has indeed climbed down on its position of mandatory vaccination in the public service?
Madam Speaker, that will be caught up in what I said. When I said that given the surprisingly good result and the behavior of Omicron, that we have placed hold on drastic actions because the circumstances have changed drastically between mid-December and March.